Hello, my name is Miranda Dumag, and today I will be presenting my case study titled Identifying E. coli Using Culture and Biochemical Testing. So, for this presentation, it is a part of my Bio 225 course for October 31st, 2025, and I will be walking you through on how common lab tests will identify E. coli as the cause of a patient's gastrointestinal infection and why these methods are still essential in clinical microbiology. So first, we're going to start off with the background. E. coli is a gram-negative bacterium that's usually harmless in the intestines, but some strains can cause serious infections like UTIs, diarrhea, or even sepsis. Many foodborne infections also come from undercooked beef or even contaminated produce, which is why it's such a public health concern. Quick and accurate lab identification is crucial. It does help guide treatment early and also prevents complications or even outbreaks. So for the case presentation, the case involves a 23-year-old woman who came in with abdominal cramps, diarrhea, a mild fever of 100.4, and signs of dehydration after eating undercooked ground beef. So the clinician did suspect an enteric bacterial infection, most likely E. coli, due to her symptoms and her recent food exposure. So for the method, a stool sample was collected and streaked onto two types of agar plates, the EMB agar plate and an MSA agar plate. Additional biochemical tests were done, including the gram stain, catalase test, and an oxidase test. All plates were incubated at 37 degrees Celsius, or 98.6 Fahrenheit. For 48 hours, and this will allow for colonies to grow and to be observed for typical E. coli characteristics. So we'll be able to tell which E. coli is what in her body. So the results were clear on EMB agar metallic agar plate. Metallic green colonies were formed, which is also a classic sign of lactose fermentation, typically of E. coli. The MSA plate did show little to no growth, confirming E. coli isn't salt tolerant. The catalase test was positive, producing bubbles that showed hydrogen peroxide breakdown, and the oxidase test was negative, meaning no color change occurred. These findings did fit the biochemical profile of E. coli perfectly. The interpretation and diagnosis of this, so putting it all together, the EMB growth confirmed a gram-negative lactose fermenter, which the lack of growth on MSA showed it's not halotolerant, and the catalase and oxidase reactions confirmed typical E. coli enzyme activity. Based on the results, the final diagnosis was Escherichia coli, or E. coli, gastroenteritis. So for supportive care, it is recommended, and the treatment does focus on supportive care for mainly it being hydration, so tons of fluids along with a lot of rest as well. In severe systemic cases, antibiotics may be needed, but they should also be careful and guided by susceptibility testing to avoid antibiotic resistance. But with the proper care, most patients recover within 5 to 7 days naturally with just hydration and rest and not needing any antibiotics. So the conclusion, the case demonstrates how selective media and simple biochemical tests can accurately identify bacteria like E. coli. The EMB, agar, and enzyme tests were key tools in confirming the diagnosis. Early, accurate identification not only improves the patient outcome, but it also helps prevent complications and reduces unnecessary antibiotic use as well. And this is the references. These results and interpretations were supported by several microbiology textbooks, resources, including works by Croxon, Forbes, Coleman, and the CDC. Together, they do emphasize the continued importance of cultural-based diagnostics and modern microbiology. And that is it. Thank you very much.